Hi, good afternoon, everyone. My name is Sheila Poole. I am the commissioner here at the Office of Children and Family Services, and I am honored to be with you today and to welcome you to our sixth anti-trafficking conference. I can't believe it's been 6 years since we began these convenings. This is our second year virtually, but that apparently is no deterrent to all of our anti-trafficking partners coming together because we are breaking our attendance record. We have well over 300 participants statewide, along with our national partners joining us today. So that's just fantastic. This is also the second year that we have Safe Harbor partners in every single county in our state, which is remarkable and certainly testimony to the incredible commitment, not only here at OCFS and our team with Madeline and Christine and Nina, who I'll introduce in a moment, but, every day we continue to read horrific accounts of trafficking, many, of course, as you all know, of vulnerable young people, runaway homeless youth, and kids in foster care, just LGBTQ youth who are disenfranchised from their families, so many at-risk populations that we touch and care about here, and I know you do too. And we've got so much work to be done. There's never enough money, we know that. But what you have all been able to do at the local level with relatively modest pots of money, I think is really remarkable. And I do want to acknowledge the powerful impact that many of you have made. And of course, we all know it's possible when we do it together, when we find our partners who are also troubled and are willing to work together. So I want to thank and salute all of you. I also loved that the theme for this year's conference is equity. It's a frequent topic of conversation right across our country, as it should be, and the fact that you have really intentionally lifted up equity, that again, I think defines so many of our vulnerable youth and young adults across the state. And I can tell you from looking at the equity agenda, the team here has brought together some amazing speakers, and we all know there is so much work to be done and things to learn. And just before I turn it over to Deputy Commissioner Aladorta, I do want to thank our small but amazingly powerful and committed team here. Of course, Madeline Hine, who you all know, and Christine Anderson, a small but powerful group, and I'm really proud of what you do, and I thank you for it. And I'm also really proud of the work that Nina, Dr. Aladort, leads in our Division of Youth Development and Opportunities for Success. So I am going to turn it over to you, Nina, to do some additional introductory remarks. And I look forward to being a part of the summit today. Thank you all.
Thank you so much, Commissioner. Can you all hear me all right? I'm still showing up as Christine, but that's okay. I had some technical difficulties, shockingly enough, almost 2 years into being online with everybody. So I just want to say, just start with a thank you to everybody who is participating today. As Commissioner Poole lifted up, but we have relatively small amounts of money across the state to really address a scourge, an international scourge, and that has been in existence for, as long as there have been people who have been sexually exploiting other people commercially. And the work that all of you take on every single day in the face of sort of multinational corporations that essentially don't do enough to safeguard our young people who are using their technology, that look at sometimes profits over people, and we are in the trenches, you are in the trenches every single day with some of the fallout, right, of what happens when we don't pay enough attention to the youngest people who are the most vulnerable. And I think that's really at the center today of that equity conversation. This isn't just about race, ethnicity, and sexual orientation, gender identity, and gender expression. It is also about a global sense of what is equitable. It is an economic equity conversation as well for the young people who often are tricked into the life, but leaving the life has real economic consequences for them, as horrific as it can be to be in the life. And how do we address the sort of global equity questions that are ahead of us when trying to help young people heal from and make the decision to walk away from trafficking when they have that opportunity and stay out of it? So I am very proud of our team. I'm very proud of all the work that's been done across the state. I'm very excited about this conversation. I just want to offer some thoughts for folks to have as we go into this conversation over the next few days, sort of framing things in our minds about, when I think about equity, one of the questions that I ask myself is, would it be good enough for either my child or a child that I love? Sort of using that my child standard, because that really helps to ground it for everybody. It makes it very personal, gives us all a personal stake in the equity for all of the young people that we're working with and in support of. What does it mean to have an equity question, right? And for me, it means who's better off and who isn't better off. And what is it that we're doing structurally to help make sure that everybody has the same opportunities to be better off, so that if you're in one county versus another, you have the same potential opportunities as somebody does, and that you're not just left to sort of justice by geography. How do we know if somebody isn't better off? Who aren't we seeing, or what aren't we seeing in front of us that we can think about having a better lens? And who aren't we hearing? How do we engage the voices of the young people and the survivors to make sure that the work that we are doing every day is grounded in the real experiences? And how do we keep having that conversation because the conditions on the ground change so frequently and so quickly? So I'm very, very excited. Super proud that this is our 6th. Sometimes it feels like 10, sometimes it feels like 2. Hopefully we'll be able to see you all in the same room again at some point in the near future. But again, thank you to Madeline Hare, Christine Anderson, thank you to WRI, thank you to our team, and thank you all for the great work that you do every single day. And thank you to the brave young people who continue to show up and work with us to make their lives better and more equitable. So I'm going to hand it off now to Christine. Is that to you?
Thank you so much. Can everyone hear me okay? Thank you so much, Commissioner Poole and Deputy Commissioner Aladort, for those great words. It's the perfect kickoff to this event. Good afternoon, everyone. Happy Summit. For those of you I haven't had the pleasure of meeting yet, my name is Christine Anderson. I am the Anti-Trafficking and Runaway and Homeless Youth Coordinator at OCFS in the Division of Youth Development and Partnerships for Success. In that role, I serve as the Program Manager for the Safe Harbor New York program, and I am super thrilled to be welcoming you all to, as Sheila said, our 6th annual Anti-Trafficking Summit and our 2nd year of having it virtually. And I appreciate you all being here today. A few quick housekeeping items before we get started. Summit is a week-long event. As you all know, there are 2 sessions every afternoon, one at 12:30 and one at 2:30, except for Friday when there is only one afternoon session. Zoom links for each session were already sent out last week. If for some reason you did not receive your Zoom link, please let one of us know and we will get it to you as soon as possible. If at any point you encounter any IT issues with the presentations, you can email info@welfareresearch.org, which we will also put in the chat, and help will be sent your way. If you have an IT issue, again, please feel free to reach out. If for some reason we can't get a hold of you at Welfare Research, you can email us at OCFS and we will help you out. All presentations are being recorded and will be posted after the event for future viewings. If you like something so much and you want to watch it again, or if you have staff that missed something, they do have an opportunity to get caught up. Certificates will be issued after all of the summit presentations are done by request only. So if you don't request one, they're not going to be issued automatically. If you need one or would like one, please send your name and email address to our human trafficking mailbox. Again, just so people are aware, we're not issuing them until after the whole week is completed. And this takes us a week or so, so just please be patient. We will not forget about you, I promise. Next week, we will send out a post-summit survey, and please use this opportunity to provide us feedback about the event so we can incorporate all of that into our future sessions. Lastly, all participants are muted during every presentation. Each presenter has about 45 minutes or so of content, including activities, and we'll reserve about 15 minutes at the end for Q&A. If you have a question or comment during the presentation, you can put those in the chat box. Please make sure that your chat is set to either host and panelists or everyone so we can make sure we see it. We ask that you hold questions until the end, but if you have something you really want to get out at any time, please feel free, and we'll get to as many questions as time allows. If we don't get to your question, we have the ability to see the chat and we will get you an answer after the fact. And with all of that said, I am so excited to introduce today's presenters from Family Counseling Service of the Finger Lakes, Mitchell Lee and Amy Babiaras. I'm going to give you a quick rundown of all their qualifications. Mitchell holds a Bachelor of Arts in Art and Design from Keuka College and is an LGBTQ program coordinator with the Family Counseling Service of the Finger Lakes Incorporated. He's been advocating for LGBTQ rights for 11 years all over the country. Areas of his expertise include Dignity for All Students Act, the New York State name change process, and facilitating dialogues to create an understanding of the importance of transgender rights. Amy currently acts as the co-coordinator of the LGBTQ Center of the Finger Lakes. She specializes in work with victims of domestic violence and has specialized training in navigating legal and human services. Amy's worked very closely with child welfare systems in the past and continues to funnel her passion for justice into her work through training, education, and sits on several law enforcement reform boards. I am super jazzed for their presentation. I'm so grateful they're here today. I'm going to turn it over to them.
Thank you so much, Christine.
Morning, everyone, or afternoon, I guess. Thank you so much for spending your afternoon with us. We're really excited to be able to bring this information and education to you. As we said, if there are questions that you have during the presentation, please feel free to send them into the chat. If we can't answer them, we will get to them as quickly as possible. And we're going to do our very best to get all of your questions answered. We have our contact information available, so if you have more questions or you want more information, you can always feel free to reach out to us.
My name is Mitch. I use he, him, his pronouns, and I am one of our LGBTQ program coordinators for Yates and Wayne counties through our parent agency, Family Counseling Service.
My name is Amy. I use she, her, hers pronouns, and I am the program coordinator for Ontario and Seneca counties.
Our agency works across the board to help and advocate for victims of crime and their families. And so we work in connection with case managers, educators, counselors, and therapists, as well as other advocates to provide services to not just the lesbian, gay, bisexual, transgender, queer, and questioning community, but all victims of crime within our 4 counties of focus. We primarily work in Ontario, Seneca, Yates, and Wayne counties. However, we have recently expanded up into Monroe with a recent partnership with Bivona. And here in the LGBTQ program, we have a long-standing history of welcoming attendees to our programming, regardless of where their location is. That has been actually made easier during the COVID-19 pandemic with our switch to virtual programming. Today's learning objectives are going to take us through a lot of things very rapid fire. So You will always be able to refer back to the recording for more clarification, and certainly we will be responsive to questions as much as we can be today. But first, we're going to use the lens of trauma-informed care to learn about some tangible ways that we can support LGBTQ youth who are at risk for or have experienced trafficking. Then we will be able to identify red flags of abuse and trafficking, including with our handout that you will be able to hang on to long term. Then we will practice how to intervene effectively and interrupt bias that our clients may encounter. And finally, obtain resources specific to serving LGBTQ youth. We are going to use a program today for responses to some scenarios that are real world scenarios of clients that we have worked with in our roles as advocates. And that platform is called Incognito. So you can either type in this URL in a separate tab or on your phone. Amy will post the link in the chat as well. What this allows people to do is respond anonymously. You do have the option of putting an email in, and if you would like us to respond to you, we can do so without seeing your email. So if you have a question that you're not comfortable being on the recording or asking in front of a large group, definitely pop it in there and let us know you'd like us to respond to you personally, and we will do our best to get back to everyone after the training wraps up.
So we, as an agency, focus our care for victims of crime through a trauma-informed lens. So we know that effective care is transformed by effective education. Through our agency's initiative, the Finger Lakes Resiliency Network, or FLRN, you might hear us use that acronym. We focus on 6 core values as guiding principles in all of our work. So we're going to have you take out your phones and scan the QR code that's here in the center, or if you're not really sure how to do that, or you're using your phones to access this, you can also pull up your web browser and type in menti.com. And then this will bring you to a site where you'll be asked for a code. So the code I will also put in the chat, but it is 73774016. So we want you to name something that you think may be a core value of trauma-informed care. And I will get that in here right now so that we are easing access. Awesome. So we're seeing choice, compassion, empathy is a big one. Empathy is the one that keeps growing bigger here in our word cloud. Understanding, non-judgmental, strength-based. Yeah, so these are all really great tools to take when we're working with our victims, with our clients, with our community at large. Let me see if I can share this word cloud. I don't think that we can dual. So what I'm going to do is I'm going to send this word cloud out to everybody when at the end of this summit so that you all can see what the word cloud looks like, because we unfortunately cannot dual screen share right now. Awesome. So that is great. I'm really looking forward to sending that out to you.
So we know that effective advocacy, being trauma-informed, is key to having successful outcomes for our clients. The 6 core values that we observe through FLRN and through our agency are safety, trustworthiness, support, collaboration, empowerment, and equity. To give you an idea of what some of these often come off as buzzwords look like in practice, when we're talking about trauma-informed advocacy for the LGBTQ community, safety and support go hand in hand. This can be provision of LGBTQ specific community spaces or groups. This can be assistance with court processes or meeting basic needs, and also being someone to call in event of a crisis or a need popping up. Just being visible in the community so people have somewhere to turn is huge. And this is also culturally responsive and individualized safety planning, because we know that not everybody needs or can trust the same things. Trustworthiness definitely comes from the sustainability of LGBTQ inclusion within an organization. So that can look like making sure that there are consistent and clear responses, no matter which staff member a client is speaking with. That can also be growing and developing beyond just one or two staff who feel comfortable speaking to these topics. Commitment to inclusion has to continue within an organization, even when current staff move on or policies change. It's definitely something that has to stay in place to build that trust with the LGBTQ community. Education is a highly effective tool for collaboration because when we are able to then put the tools that we have in the hands of people at other organizations and offer tailored sessions like today's that are specific to certain needs, we have then given other people the tools that they need to go on without us. It's also very important to be involved in organizing things like police reform boards, suicide prevention and postvention networks, and crisis response teams to give context and represent the diverse needs that we all have within our communities. Empowerment, I often say, is the very crux of resiliency, because when we teach both coping and life skills and model action planning, and truly take the time to inform survivors of their rights and of all of their possible options, we're giving them what they need to move forward. Clients don't need us to do it all for them or pave the way necessarily. They are so much better served by our belief that they can and are giving them the support they need to move forward. Finally, equity, the theme of this week's conference. Advocating for equity as service providers can mean pushing for inclusive policy on the state and federal level, as well as taking an in-depth look at the policies within our own systems and organizations, or even ones in our community, to take into account the input from clients and from the LGBTQ community specifically, to be better and do better and lead by example. So we can take a look at the data that is available to us, and we can glean that about 1 out of every 25 people in New York State self-identifies as LGBTQ. We can come to this estimation by looking at the 2020 United States Census for New York State, which estimated 19,450,000 people who live here in our state. The organization that does Gallup polls every year recently did a 2021 update that found in their sample group that 5.6% of adult American respondents to their survey self-identified as LGBT, so specifically lesbian, gay, bisexual, or transgender. If we apply that figure to our census data for the state, that gives us an estimated number of 1,089,200 self-identified LGBTQ people living in this service area. It's important to keep in mind that within the community, the 5.6 figure is considered to be low. And certainly there's a whole host of labels that were not included in the way this data was collected, because these standards of data, you'll kind of see this as a theme throughout our presentation, are often very different organization to organization. The other thing I like to point out with this chart here too is that someone who identifies as transgender may also identify as lesbian, gay, or bisexual. So the way that data around sexual orientation and gender identity is collected is going to continue to shift as we learn more. Of unhoused youth, we know from a TED Talk that was done specifically regarding LGBTQ youth engagement in survival sex, that between 20 to 40% of unhoused youth identify as LGBTQ themselves. And according to the Polaris Project, who is a global leader on trafficking prevention for all ages, we know that of these youth, around 46% left home or ran away because of familial rejection. They are also 7.4 times more likely to experience acts of sexual violence in their lifetimes than their heterosexual peers. And they are 3 to 7 times more likely to engage in survival sex to meet basic needs. Needs like housing, food, access to medical care, access to gender affirming care, things like that all fall under that. Now, none of these entities have specific data on trafficking or violent crime against LGBTQ youth. So where is that data? What's important to understand is that LGBTQ rights and representation are still very much works in progress. Each year, the transgender community has an observance called Transgender Day of Remembrance and Resilience, called TDOR for short, that we've observed since 1999. This day is partially observed by a reading of the names of all of the transgender people whose lives were lost in the year before to anti-transgender violence. Transgender women of color are disproportionately affected by this, and 2020 was the worst year on record here in the United States, with 44 lives lost. Tracking through the Human Rights Campaign tells us that as of this morning in 2021, we are at 40, with our most recent reported loss being 26-year-old Royal Poetical Stars, a Black transgender woman who was fatally shot in Miami Gardens, Florida on October 2nd. Why is the Human Rights Campaign the one tracking this data? Because law enforcement doesn't necessarily have to. So federally, law enforcement agencies are not required to record or report on the sexual orientation or gender identity or gender expression of a victim of violent crime or of someone who completes suicide. They may voluntarily do, and many agencies already have a policy where they do so, but it's not a universal requirement. Here in New York State, we have narrower laws that do require collection of this data in some types of crime, but it's not a comprehensive data collection standard. A law has been reintroduced that would require entries that are made in the National Violent Death Reporting System managed by the CDC to include this data. Finally, we are also still waiting on the passage of the Equality Act. This is the long overdue federal non-discrimination law that would include people of all sexual orientations, gender identities, and expressions in its protections. These protections that are not currently federal include protecting people from losing their jobs, losing their homes, losing their credit for being or for being perceived as LGBTQ. And it will also require equal access to services and programs that may currently refuse to serve LGBTQ people or people they perceive to be LGBTQ. So this is just a tip of the iceberg in regards to identifying the systemic gaps that too often end up failing LGBTQ victims of crime. These two pie charts should be familiar. These come from our New York State 2019 Safe Harbors Data Report, and they show us the reported sexual orientations and gender identities of youth who met the federal definition of a victim or survivor of human trafficking. So of those 339 youth, we have seen here collected that they identified as straight or as a sexual orientation other than straight. And then the gender identity data that was collected was female, male, or transgender, gender nonconforming, or non-binary as a third category. What's important to be aware of is on the left, that massive gray area that is unreported, and on the right, the failure of this data collection to affirm the gender identity of the youth reported upon. However, we know that this is by no means conclusive and that we are constantly doing our best with the practices that we have in place. But it's important that we acknowledge that this is where we can sometimes easily fall into the trap of survivor bias or focusing on the areas of what we got back rather than taking into consideration what we didn't and what didn't make it onto the radar of safe harbor service providers. Survivor bias is a logical bias that can lead us to being overly optimistic sometimes because failures aren't seen. So a famous example of this is taking into consideration where to armor planes based on where they were most hit when they returned, rather than thinking about if they were hit in those other places, that's why they didn't come back. So with this, this is the data we have. These are the people who made it to service providers and what they were asked or were comfortable reporting at that time, it's by no means a conclusive look at the youth that we are currently serving.
So in doing the work that we do, our ability to determine red flags and protective factors is crucial. So many times our clients will not use words to tell us when something is wrong. Red flags are what we really have to be doing that digging for and paying attention to. So red flags take on many looks, including verbal, physical, emotional, and external behavioral clues, meaning the people around our client might be the ones providing the red flags for us. So if we can determine these red flags as they arise, we can focus our attention and our service to our clients with a laser focus and disrupt the cycles before they begin. So something that we don't talk about often is teen dating violence. And so there is a tendency to downplay relationships into which teens enter, but this is really dangerous. Teens have just as much of a capacity to be in a meaningful relationship as adults do. And sometimes we get stuck thinking about teens and youth as people, but a little bit less than adult people. And that's really dangerous. So the important thing to know here is that domestic violence is always centered on power and control tactics, age, gender identity, and sexual orientation notwithstanding. In teen dating violence, it's much the same. So when we're talking about LGBTQ domestic violence, it's also important to know two things in particular. So historically, we have been taught that domestic violence is between a man and a woman, and that the man is always the abuser and the woman is the victim, and it's always physical. But this is really dangerous because this is taught through what's called a heteronormative lens. And this is also taught through the lens of adults. We don't often talk about what dating violence looks like between teens and youth. There are also societal barriers of homophobia, biphobia, or transphobia. So negative actions that are taken against people who are LGBTQ because of their identity by people who are uncomfortable with that. So we often call this the LGBTQ power and control tire because these phobias and these societal barriers often compound treating domestic violence. So really quickly on this, I want to bring your attention to two areas specifically where we need to hone in our focus. Isolation and exclusion and sexual coercion are the two areas that are huge red flags for trafficking. So in teen dating violence, this can look like controlling clothes, controlling friends and activities, limiting access to outside involvement, using jealousy to justify actions, manipulating people into sexual acts, or forced by use of drugs and alcohol, and forced impregnating. So this kind of made some people scratch their heads when we were talking about this, but there's a very common practice in sexual assault called stealth or stealthing. And this is where a partner will consent to use protection and then will secretly remove the protection before penetration. This is a form of sexual assault, and it's really important to discuss it because not a lot of people know the language around this. It's a means of taking what you want by manipulation, and it's potentially forcing a partner to remain with you due to pregnancy or passage of STDs, and then saying, well, nobody would want to be with you, you're HIV positive. So this is very dangerous, and it is more common than people realize. On our next slide, you're going to see a couple of pie charts. We really like our pie charts here at the LGBTQ program. These graphs reflect a study that were done in 2017. So again, this is some of the most recent data we have to date, and it only reflects around 2,000 reports nationally. So we know, based on the statistics we saw just earlier in this training, that that's wildly underreported. So the numbers here on these graphs are ages 19 to 59. And in this study, there were some ages that were younger than 19. But it's important to discuss these ages here because it's crucial to know that if we don't disrupt cycles of abuse in youth, these cycles are going to continue on well into adulthood and sometimes maybe never break. So the rise in numbers and the reason we see lack of discussion around this is largely due in part to cultural normalization of these crimes and a decrease in funding to target and research these issues. When we don't talk about these issues, though, we're continuing these patterns of trauma. So education and continual focus are crucial in serving our community. I want to point out too that nearly half of those who participated in this survey reported being denied shelter because of their domestic violence, or for their domestic violence, excuse me. And of that percentage, 32% stated that it was due to their gender identity. So if we're not focusing on mitigating crisis and providing acceptance and education, we know these trends are going to continue on into adulthood. So on the next slide, we got a scenario now, which Mitch will talk to you a little bit about.
So with these scenarios, this is where we really want to encourage participation with that incognito link that's here at the bottom again. What we've tried to do is pull together real examples of cases that we have worked with in our role as advocates. So you're going to answer the question of what red flags for potential trafficking do you see within this scenario at that incognito link, or by participating in the chat as well. So a 16-year-old youth in a school district in your county is feeling very isolated and interested in dating. However, she doesn't know anyone else in her school or community who is also attracted to women. She participates in athletics at school, but doesn't know how her teammates would feel about her if she came out. And the school's gender and sexuality alliance isn't meeting currently because the advisor retired. So instead, she seeks out online spaces where she can meet other people. She joins a message board-based website and hits it off with another user who tells her more about a gay bar in a nearby city and asks her if she would like to go there to meet some friends. All the youth needs to do is give her her address so she can pick her up and a photograph for making a fake ID. So either in the chat or at that incognito link, what are some red flags for potential trafficking that we're noticing in this scenario?
Hey, Mitch, it looks like we're already getting a lot of great answers in the chat. People are saying red flags are sending personal information, isolation, getting a fake ID, talking to an older person.
Yeah, there's another really great one that says not feeling a connection to someone safe. Yeah, that's a huge red flag. Risky online behavior and being isolated, possible fake empathy, personal information. Yeah, reaching out to unknown supports. These are all huge red flags that we see online. Yeah, the internet can be a pretty big red flag in and of itself.
The issue of athletics and not knowing if your team is going to be supportive or not, that's a huge, very multidimensional topic that we've encountered on many different levels. And having a safe place in school is such a strong protective factor because it's a teacher then who advises a club that if a student has an issue in a day-to-day, there's someone who has eyes on them who is an identified ally. So missing that is another big piece.
Yeah, and I like that a lot of you are also bringing up that this youth is being encouraged to break the law and participate in crimes, right? And that sort of perpetuates some of those negative stereotypes that we see, which continues giving rise to the fact that maybe she should keep this a secret, maybe she doesn't belong, right? So now the messaging that she's getting is that her identity deserves to be shamed and secreted. Yes, no one else knows what she's doing. Right. There's a lot of red flags you all are picking up on.
Absolutely. And two, with youth who engage in these online spaces that are not run by a program like ours or an organization like the Trevor Project, who manage safe online spaces for LGBTQ youth to find support, we know for a fact on the internet that you never know who you're talking to.
Any final answers before we move on? All right, great work.
So this is where I want to talk about something called the bootstrap fallacy. The truth is, if you've ever tried to think about picking yourself up from your bootstraps, you're not really going to get yourself off the ground. If you're on the ground, you're maybe going to do a somersault or just continue to sit there. It physically doesn't work. And so the same is the fact that someone cannot lift themselves out of a situation alone. And that's not an idea that we want to teach or validate, especially to our youth. With community and systemic supports in our educational systems, in our after-school programs, in the youth bureaus in our counties, we can make great strides to improve outcomes for youth without expecting them to do it entirely alone. So many youth come to our program having no idea that there are supports for them anywhere or that they have rights and protections. And that's because they thought they had to do this alone prior to whatever happenstance got them our information. So it's very common rhetoric, but that's just not how improving our outcomes alone works. So here is our second scenario. Now, earlier we talked about trauma-informed care, and I have up here our 6 core values of safety, trustworthiness, support, collaboration, empowerment, and equity. But all of the answers we got from you earlier are all valid lenses through which to look at this as well. So for this scenario, using those core values and thinking about trauma-informed care, how could this youth have been supported differently earlier on in this scenario? So scenario 2 tells us that a 14-year-old youth in a school district in your county recently came out as non-binary and asked to be referred to with they, them pronouns at school. Other students began bullying this student, and they began having problems in gym class and when trying to use the bathrooms at school. The school guidance counselor calls home and asks the youth's foster parents what they want done to address the situation when the youth had not come out at home yet. The youth leaves school and doesn't return home that night or to school the next day.
So we're going to use that same link that you used for the first scenario for the second scenario. If you need me to drop it in the chat again, I can. Okay, so I'm seeing a lot of the guidance counselor should have spoken first with the youth before calling home. I'm seeing see how we could best support them, modeling behavior by using the pronouns at school and showing other youth how to model that behavior. Trustworthy and safetyness, building that up, having conversations with the youth. Yeah, so there's a lot of making sure that you're speaking with that youth to determine where they are, if it's safe for them, what that might look like. Something that we hear a lot in our 3-hour long safe zone training is people will say, well, what about parent rights? Doesn't the parent have the right to know this about their child? And the answer is sometimes they do have that right. And sometimes it's a matter of safety. So sometimes parents don't have the right to know things that youth have said in confidence to school if the school also has the feeling or the child has said, if I tell my parents or I tell my guidance or my guardian or whoever it may be that I am non-binary or I'm LGBTQ, I'm going to lose my housing. They're going to physically hurt me. I'm going to get kicked out. I'm going to lose schooling. So if we know that we're going to be creating an unsafe situation with this information, it's our responsibility to keep that youth safe. It does get tricky when we're talking about parent rights versus where the school can step in or where service providers can step in. But the other thing that we always say is that youth will tell you who they are when they're safe to do so and when they know that they're safe to do so. So our core responsibility becomes creating that safe space and fostering open communication to maybe build and plant those seeds to say, great, thank you so much for telling me this. How would you like to navigate this? Or what does this mean to you right now? Because we might be able to overcome some of those anxieties. And maybe the youth is safe at home, but they don't know that because they haven't been able to have that conversation. So it's very much centered around having communication and conversations with our youth. Yes, determining safety levels, seeing what other supports that youth may be able to connect with. Educating students on pronouns, using inclusive language. Yes, it's a lot of centering around what the youth knows their reality to be and our responsibility to create that safety for them.
Yes, definitely. We say this of all LGBTQ people, regardless of age. Coming out is a personal decision and something that an individual should always be given the agency to control when and how and where. To share someone's identity without clarifying with them that they want us to do that, which they may do, that is called outing. And we have seen many, many times in our work incredibly dangerous situations resulting from that. The other bit of reassurance that I always like to offer students is that here in New York State, the Department of Education has the Dignity for All Students Act. Christine mentioned it earlier. This is one of my wheelhouses and things that I like to talk a lot about. But the short of it is that transgender, gender nonconforming, and non-binary students have the right to be respected in names, pronouns, and identity at school in New York State, period, full sentence. The Department of Education has a fantastic guide on creating a policy within your school for when a student comes out and wants to go by different names, as to how to approach that within systems and how to do those introductions. That's actually on the State Department of Education's website. And there's all kinds of school districts that throughout the state have already implemented similar policies to help students who are going through this call their own shots on their own terms safely. So just keeping that in mind too, as a right and as a resource.
Any final thoughts before we move on? Perfect, we'll keep going then. So we're going to take a look at a couple of maps because we love our graphics. So on the left is a 2020 map of who in New York State has safe harbor funding to protect and support minors who are exploited for commercial sex. These laws include legal protections, but they also serve as a pathway to services, including medical and mental health services, treatment, housing, education assistance, job training, and legal representation assistance. I also want to point out again that New York State was the first state in our country to recognize that our youth who are victims of sexual exploitation are in fact the victims and not the perpetrators. So for a long time, there was that language around child prostitutes or, similar language until we sat down and had the discussion of no, children are not consenting to this. They're being forced into this. They're being victimized. So on the right of this is a map of just central or upstate New York's available LGBTQ resource centers. So advocacy services and educational or social organizations that specialize in supporting the LGBTQ population. The orange circle has us and the 4 counties we are currently serving. Like we said, we sort of loophole other counties in So the orange circle is all that we serve. What makes us unique in the state is that we are an LGBTQ resource center with an advocacy organization, which uniquely equips us to serve ourselves and inform other service providers in our area. So many people are unaware that the LGBTQ organization that was previously serving Rochester has severely diminished its capacity, and it's currently not offering advocacy or education. So that hit is the closest example of a stark reality that the COVID-19 pandemic resulted in the closure of about 1/3 of the existing LGBTQ resources in the USA and diminished the capacity of many more. So I'm seeing here the Q Center also serves Oneida County, which is great. We're seeing that outreach growing. So right here, it tells you which places are which. So we've got the Pride Center of Western New York in Buffalo, Family Counseling Service of the Finger Lakes, which is us in the Finger Lakes, the Q Center in Syracuse, also Oneida County, Cortland LGBTQ Center, which is in Cortland, Ithaca, the Identity Center in Binghamton, and then Capital Pride in Albany. So on this slide here, this sort of just brings home what's happening in the community where Mitch and I serve. So this slide reflects the second quarter report for sexual and labor trafficking in Ontario County. So of 26 currently active cases in the second quarter of 2021, the average age of the victim is 13 and a half, while gender identity was reported as almost entirely female. All victims did span the spectrum of sexual orientation. And like I said, this reflects only Ontario County, which is just 1 out of 62 counties. So this is what's going on in the second quarter of this year. But I want to bring to light the fact that continual access to social media and other online websites often have a hand in the rates of abuse of youth. We just saw that in that scenario where our 16-year-old was offered a fake ID if she would give her personal information out. And that's something that happens a lot more than we maybe realize. In the LGBTQ community, there is often a feeling of fear, of isolation, loneliness, a feeling of being misunderstood. When someone's on their identity journey, it's often something that's being done alone and silently for fear of judgment. We also know that we're running the risk of losing all of our stability or being abused. Groomers and perpetrators know this, and they use it to their advantage. So many times we see our youth and our vulnerable adults preyed on by people saying things like, no one else will ever understand you the way that I do. I made it through and I'm okay. Why don't we meet up here? Or give me your address and I'll pick you up. We can go somewhere. Groomers and perpetrators are professionals at manipulation. When you hear that someone's telling you they've met somebody or an adult is giving them guidance, this isn't necessarily a red flag, but it is a flag for you to do some more digging. So maybe it's like a yellow flag. Adults can be, and often are, wonderful supports and mentors to our youth, and this should absolutely be celebrated. We know that it takes just one supportive person in an LGBTQ person's life to sort of make or break the path that they get to go on. And we want we want our youth to identify external supports who can assist them, but we cannot be making the assumption that the people they're talking to is safe, especially if they're saying that they've met them online. If it's their Spanish teacher, that might be something a little bit different, right? You see them every day. We get close to teachers who we identify with. But if our youth are saying, or our clients are saying, I've met this person, they live in California, they're offering to fly me out to them, that's obviously a much bigger flag, and we need to do some digging around that. So again, having mentors is great, and it's not something that we necessarily need to be worried about, but it tells us we need to just do a little bit more digging to figure out who this person is in their life.
All right, so we're going to hop into our third scenario and use that same link with the incognito to think about what supports are you aware of near you that you could connect this youth with if you were in front of this situation. So scenario 3 talks about a 19-year-old student at a local college in your county who, while navigating his gender identity, comes out to his family and they don't react well. During school breaks, the student seeks referral from his primary care physician, PCP, for mental health services while he is staying on friends' couches and trying to find employment. The referral made by the PCP was not screened, and the provider is unaffirming of the student's transgender identity at the intake session. Because of this, the student experiences a mental health crisis and is brought to the emergency room, where the crisis counselor recommends returning to the PCP for medication and that he drop out of school and relocate to New York City, where there are more resources.
So again, I've dropped that link into our chat if you're losing it, because I know we've got so many coming in that we're maybe not able to scroll. So take a few minutes to take a look at this scenario, and then we'll read out some answers. So when we're giving answers, if we're talking about agencies that are local to us, if you wouldn't mind just explaining a little bit about what that agency does, I'd love to know more about what's going on in our state, because we do have clients who come to us from all over the state, not knowing where to turn, and being able to say, oh, well, we did this training and now I know that I can send somebody to Center Lane. I don't know what Center Lane is, but it sounds like a great resource. So I'd love to know just a little bit more in our answers. So we're seeing an on-campus advocate to assist with assistance at the college or transitioning to online classes. Right, school might be the only place where they feel support. Peer programming within college, awesome. The Pride Centers, yep. Health services where we know gender-affirming physical and mental health will be provided. Support groups. Some of you are unsure, and that's also okay. Things are developing and growing all the time. We're seeing new agencies open all the time. We're seeing more education be put on to different communities as we realize that there's a need growing in that. So if you're unsure where you might turn, that's also okay. That maybe is an indication to have some discussions with supervisors around, hey, what does exist around here? How could we bridge some gaps here? We do a lot of networking, and I know that you all work with so many different agencies across the board, and it can be kind of hard to remember, or maybe we have like a basic scope of what an agency does, but not a broad scope. So these are just some points to do a little bit more digging, personal research, just to see what's going on. Cayuga Counseling Services provides mental health services, prescriber, and a pharmacy all at one location, which is so helpful.
So we also will be giving some national resources as well at the end that you can always keep in your back pocket, as well as our contact information.
I'm also enjoying seeing such a focus on finding affirming mental health care, because we know that that's so crucial, and that it can be really hard to find a counselor where you feel you're safe. And sometimes people have to go through 3, 4, 5 counselors before they find the right one. I'm seeing some people say they wish they had more specific supports other than therapy. That's also a great opportunity to reach out to other identified services and say, hey, how might we be able to partner? So these are all just really great opportunities to sort of identify areas of growth, identify areas of strength, and then how we can sort of bridge those together to keep building that scaffolding up. It sounds like there are so many amazing services all over our state, though. I love hearing all of these.
This scenario especially is very close to the heart for me, because this was my own personal experience. And it was supports that were in place on the college level. So mental health services on campus, peer-led services on campus, and then the very beginning of the program that I now represent here today was there for me at that time as well. And so even those small things that we think are just minor supports make a huge world of difference in changing people's potential outcomes.
Any final thoughts? And like we've said at the beginning of this training, if nothing else, know that we are here as a resource for you and that you can reach out at any time with any question and we will do our best. We always say if we don't know the answer, we'll find it together. So you are always welcome to reach out to me and to Mitch, to our program or our agency at large. We don't ever turn anybody away. And if it's not a community or a county that we serve, we will find whatever we need to find in order to bridge those service gaps until we can get them to the right area. Some great work.
Great. So the last thing that I want to address, and Amy is going to lead us through an activity and practice this, is interrupting. So interrupting is calmly and immediately addressing harmful statements or actions we may encounter to clarify, to educate, and to clearly iterate that bias is not going to be accepted in the space we're currently occupying. Interrupting is not aggressively questioning or challenging or closing off communication with somebody or trying to punish, because the thing is, we always try to assume goodwill. Some people say things sometimes that are based on their own lived experience and the knowledge that they have up to date. And they may be making a very harmful statement, and certainly that needs to be educated, but it's not a punitive thing that we want to put in place for those people. Who should do the interrupting is allies first. Those who are not personally targeted by the statement or action is always ideal, especially when we're talking about youth. A youth should never have to challenge a biased statement coming from an adult. That should always be something that an adult in the space with them who is an advocate for them will interrupt. And if the bias is a long-term pattern of behavior, the next steps definitely depend on the role of the individual with the pattern of biased behavior, but every organization should have policies and procedures in place for addressing patterns of discriminatory behavior within their organization. So within our schools, we know that that's the Dignity for All Students Act process. Title IX, when we're talking about collegiate spaces, and there are individualized policies within almost every agency and organization as well.
So we have 4 little mini scenarios that we're going to go through. So how might we interrupt bias we encounter as professionals? And we're looking for how we might interrupt bias in addition to education. So we'll start with number 1. We can do the same thing where we either use incognito or drop it in the chat. So a worker at a shelter where you have placed clients states that they will only place clients and offer clothing according to their sex assigned at birth. How might we interrupt that? Any thoughts on how we might interrupt working at a worker at a shelter denying clothing according to the client's identity? Let's hop back a slide and look at the techniques we have. So we've got, someone just said education through collaboration, saying that's appropriate and that we follow equity behavior. That's inappropriate, excuse me, following equity behavior. So when we're saying education, what might that look like for this worker? Great, so looking for alternative resources for youth, engaging in systems changing, meeting with leadership, allowing the youth to select, educating on how harmful those stereotypes might be. Yeah, reminding if there's a gender affirming policy at this place, reminding them of that. Speaking to the shelter worker to support the youth by meeting them where they're at and asking them to honor the identity. Yeah, these are all great. Maybe ask if it's personal preference or policy. I like that. Speaking directly and honestly. Yep. So speaking directly and honestly with staff, but if that doesn't work, going up the chain of command and also looking into alternative agencies, communicating that this is bias, behavior, training on gender affirming language. Yeah, these are all great forms of interruption. Awesome. So we're going to move on to the next one. So a coworker shares that they don't think a woman in a same-sex relationship can be abused because her partner is also a woman. How might we interrupt this? Share known statistics if we have them available. Explain the power and control wheel. Absolutely. How else might we interrupt this? In form of power and control. Let's see here. Education on domestic violence, show her facts. Respond that that's that person's personal opinion. Asking why they think that that's the case. Yeah, that's great. Asking if they're aware of other non-physical types of domestic violence. Identify forms of abuse and reflect on whether gender plays a role in the action. There's a good one, asking if strangers on the street would only be arrested if it was a man assaulting a woman. Yeah, that sort of turns that gender identity on its lid, right? We've been taught that it's between a man and a woman, but we know that's not true, and that's really dangerous because then we're not talking about all of the different types of abuse. Yeah, okay. Some great answers. I love that all of you are saying, nope, it's power and control. It has nothing to do with gender identity, because that is something that people think, oh, well, two women aren't even in a real relationship, so there's no way that could be abuse, when we know often that domestic violence between two women can look a lot more insidious and secretive, and it's harder to track. And so that's a very dangerous rhetoric to get stuck in. Okay, so faculty at a school shares concerns that boys will pretend to be girls in order to enter the girls' bathroom or locker rooms. How do we interrupt this? Education, effective communication and collaborating with resources, educating the staff through leadership, ask the faculty if they've experienced that or had supports that, or have observed anything that supports that perception. Ask for clarification. Why do you think this? Inform them about the Dignity for All Students Act. Asking what constitutes pretending.
Awesome responses. I have this conversation about once a week, sometimes 2 or 3 times a week. It's something that's extremely common. And what I always try to turn the conversation to is reminding folks that there are 0 documented cases of someone using a trans identity to then perpetuate assault in a public bathroom or a public locker room space. That has never been recorded as a crime in any state in the United States of America. And 2, if we are in a bathroom and someone is making us feel unsafe and uncomfortable, how do we remove ourselves from that situation safely? Can we establish a policy then for ourselves if we're nervous about who we may encounter in a bathroom, going into a buddy system approach, and really like acknowledging that fear of necessarily we don't know who we may encounter, and how we can make sure that people are feeling safe in those situations without infringing on other people's rights and ability to access the most basic of public spaces.
Yeah, and so someone asked if we could give some more specifics around this, as this is something that has been thought about before. And so there is a lot of education that we can provide. There's a lot of follow-up resources. So if you wanted to talk a little bit more in depth about that, we could certainly do that. But Mitch, do you have any other ideas that you wanted to throw out there before we move on to our last scenario?
Yeah, so I would definitely encourage looking at, since this is specifically a school scenario, guidance again from the Department of Education that transgender inclusive model school policy is really awesome at addressing this topic specifically. The issue is often coming down to a feeling of uncomfortability that's not based in an actual factual history of incidents occurring. It's actually much more dangerous for in this case, we would be talking about a transgender girl who is trying to utilize a public space. They are much more at risk than any of the other people around them statistically based on what is actually reported criminally. So remember earlier talking about Transgender Day of Remembrance and how many people in the transgender community are attacked for just trying to exist authentically in public spaces. That's documented fact and reality, whereas the reverse, we don't really see any cases having ever happened. Schools are often sometimes uncomfortable because they maybe have not been confronted with a student who's transitioned before and it's not something they've experienced. That's where I very much encourage school leadership to talk to other school leadership that maybe have had more experience in creating safe accommodations around this topic. But definitely, again, turning back to the Department of Education, and then we're going to share some resources in a little bit. There's an organization that I love called Forge that specifically does transgender inclusive trainings for shelters and service providers. And they offer a lot of tips and resources as well that I think would be really helpful for creating some more understanding around what this topic construes.
Yeah, so we have a comment that I'm just going to reply to really quickly. If you want to run this last scenario for us, Mitch.
Sure. So our final scenario is that a parent mentions that their child is going through a phase and expresses that they will pick a side soon. How might we interrupt that statement? Now, I'm only going to be able to see folks' responses in the chat. So if you want to respond to this one in the chat. There are no phases. These are their feelings.
Discussing the complexities and variations of gender versus sex.
asking the parent if they've talked to their child about this.
Gently reminding the parent that there are no sides. The parent has an opportunity to support their child in their journey. Support is important and creates safety, providing resources.
Ask them what they mean by choosing a side to understand what they mean first. Definitely. Where we hear this language kind of pop up is especially around bisexuality or pansexuality or any other identity where someone experiences attraction to more than one gender identity. And so often there's kind of this narrative that someone would stop being that identity at some point when they are in a relationship. But we know that is not true and that those identities actually hold fast.
Yeah, somebody said linking to parents who have also experienced this is a big one. Educating that this is not a pick side situation and beginning a conversation with a counselor. Yeah, those are all great. It is important to acknowledge the parent's concern for sure. And that also allows that room to discuss why they have this concern, what this might mean to them, talking about if they've discussed this with their child at all. It's important not to give the rhetoric of saying, well, you'll pick a side soon. This is just a phase, because even if it is a phase to the youth that they're in right now, that's what's important and that's their identity. And so we need to be supporting them through what they're presenting currently and not what we think may happen in the future, because how we respond to situations as they're happening is what tells our youth who's safe and how they might be responded to moving forward. And so they are great discussions to have around acknowledging concerns on both sides and discussing what it means to the youth, what it means to the family, and where to move forward. Are there any other thoughts on that? The thing that I always talk about is that we see phases in nature all the time, right? So our seasons are very cyclical. The moon goes through phases, right? Phases are very natural and they're not necessarily a bad thing. So like I said, even if we do think or know that maybe this is a phase that our youth is going through, it needs to be celebrated and supported and not just told, well, you'll get over it, because that is dangerous. And we want to make sure that we're telling youth that they're valid as they are and as they're coming to us, not that they're only valid if they come in a specific way to us. So understanding that phases are natural, they're part of nature, they're something we see all the time, and that identity is complex. And tell me what this means to you, or why do you think that they're going through a phase, right? Just having the discussion. And for all of these, there can be a discussion with the people in question of what does this mean to you? What do these identities mean to you? What ways would I best be able to support you? Or what might that look like, right? We want to be disrupting cycles. And we want to be making sure that we're providing the education, we're providing the validation and the affirmation on all sides, while still also providing the education and how we need to move forward together effectively and efficiently, instead of continuing cycles of trauma by accidentally saying the wrong thing or accidentally perpetuating stereotypes that we get kind of stuck in. Any other thoughts? Okay, so we'll hop off to the next slide. Kind of going hand in hand here with interruption, right? So we always encourage further education. So this slide has several different resources to reach out to, and we know that this is sort of just the tip of the iceberg as far as resources that we are able to link our youth to. So first and foremost on this list is Family Counseling Service of the Finger Lakes. So that's us. We provide a 3-hour safe zone training. It's completely free. We can do it virtually or in person. We also provide 4 support groups to youth and to adults. So on the first and third Monday of every month, we have a Square One group, which is for parents and family and friends. We have our youth group, You Are Not Alone, which meets every Monday from 4 to 5, and that's for ages 10 to 18. And then on opposite Thursdays of each other, we have a group for trans and gender expansive adults and for LGBTQ adults at large. So like we said, we're also sort of a one-stop shop for other advocacy services. Moving past that, we've got the New York State Civil Rights information. We have Forge, which focuses on trauma in the transgender community. We've got the Polaris Project, which focuses on fighting sex trafficking and labor trafficking. Point Source Youth, which focuses on youth homelessness. And GLSEN, or the Gay and Lesbian Straight Education Network, which focuses on safe schooling for all students. That goes hand in hand with DASA here in New York State, but it's something at large because we know that we need to be providing safe education to all students, regardless of how they identify. And this goes beyond just gender and sexuality as well. This also means that if you fall into a protected class here in New York State, you are also guaranteed and promised the right to that safe education. So it's knowing what exists as legislation in your state. We also have here the Trans Equity Consulting and the Trevor Project. The Trevor Project is something that we link our youth to quite often. It's a national 24/7 crisis service for LGBTQ youth. They can access this through a phone call, through a text message, or through chat. So this is a really great resource for when our crisis hotline is not able to. So we have a crisis hotline, but we might not always be able to get to the youth in that moment. So this is just a great national hotline to also utilize.
So just for clarification, Forge is that organization that I've mentioned earlier. Polaris gave a lot of the data that we were able to use today. Point Source Youth has tons of guides, as well as GLSEN. Trans Equity Consulting is run by a professional acquaintance of mine, Cecilia Gentili, who is a trans woman, and she provides extensive, awesome, ongoing education opportunities. And then the Trevor Project also maintains that safe, moderated online chat space as well for LGBTQ youth, so that there's a safe online space for them to engage in. And you can get information about that on their website as well. And then the hotline Amy referenced is our agency's 24/7 domestic violence crisis hotline for Ontario and Wayne counties. So we will now take any questions that folks have, and thank you again for being with us today.
Thank you both so much. I am just going to reiterate to people that if you have a question, please put it in the chat, and please make sure that your little to box is directed to either everyone or host and panelists, so we make sure we see it and don't miss you. I'm going to kick us off real quick. First of all, thank you both so very much. This is such an important topic, and it's so pivotal to the work that we do throughout the state. And a couple of things you said really stood out to me, because they are, I think, really at the core of the mission of our Safe Harbor program, and that was trustworthiness comes from sustainability of LGBTQ plus services, and youth will tell you who they are when they feel it is safe to do so. We talk so much about meeting youth where they're at and at their comfort level, and understanding that everyone's at different levels of their journey, and that's where we need to meet them. It's not a forced process. But Mitch, something else you talked about was the lack of data, and you and I talked about it prior to the call. So how do we kind of balance that? Like, trying to get such accurate data so that we can provide the services that are designated to the youth that we serve, right, based on their SOGI, but yet allowing them that time to feel comfortable to disclose to us, or, you know, and as we've talked about, sexuality can be, and please correct me if I'm out of line when I speak this, fluctuating. As we talked about phases, it can change throughout our lives. So how do we balance that? Trying to get data, but yet allowing youth time. if I'm
My
making
number one on this one, I am the world's biggest fan of a fill in the blank option. So Amy and I get paid to know the terminology inside and out and know all the different identities that people may have. And we learn new things, I would say, every day in this role. So a way that we can get data that really gives people that chance to self-define is by having a fill in the blank and people being given the choice to name their experience for themselves or to tell us they're not sure, or I've used this term, but now I'm leaning towards this term. And some people do. The word phase has kind of come to have a very negative connotation, but it's a natural part of growth. It's a natural part of life that things do fluctuate and change. For example, I identified as a lesbian for many years before I realized the pieces of my gender identity. So my identity has shifted over time. So I try to model that as well. So when we're trying to collect data, the best practice that I can recommend is certainly giving people the opportunity to self-define. And as far as getting information from youth specifically about what they're looking for and what they need, that's where I think offering visible, active supports to schools is huge. I know so much that youth benefit from knowing a place that they can go within their school to receive support. Even if they're talking about a friend and they're actually talking about their own experience, to know there's a safe person to talk to. I think we can glean a lot of really effective data from just providing an open opportunity for youth to share what's real and what's happening in their lives.
And a means of opening up that communication and that conversation too is, even if you never speak it, if you have visible signs of using pronouns, talking about pronouns, whether it's in your email signature or on a name badge, visible representation or signaling that you understand that these things exist and you're a safe person to have the discussion with, that would also tip the scales. And if youth feel safe to actually openly identify the identity they really associate with and not what they think they need to associate with because they might not be safe. So there are a few different means of maintaining those kinds of safety. And, too, the question can be asked, tell me about this identity. Tell me about your identity, what it means to you, right? Because we do know that identity can be very fluid. And sometimes it can be really hard to keep up on that. And we say all the time, we've got youth who have come out and they're trying on names before they find the one that fits them. So every time we open a support group, we'll say our name and our pronouns and ask a funny question to sort of break that ice. And so we're laying the groundwork of it's okay to change, and we're setting up and opening the space for you to identify with us as you feel safest doing.
That's wonderful. Thank you for that. I think for us, and I don't want to speak on behalf of my providers, they all do amazing work, is our ability to collect that information sometimes is limited. And our the way we collect the data is very, it's done in a very specific way. So I'm definitely going to take some of this feedback out and back and look at the way we collect the data for Safe Harbor and see how we can make it more inclusive. So I appreciate that feedback. We're hearing some wonderful comments in the chat about your presentation. I'm not surprised. One other thing I just want to bring up is, Amy, I'm so glad you mentioned stealthing, because I think that that's not something that's discussed often, hardly at all. So our population doesn't often get the opportunities to go into schools and deliver sex education. So in what other ways can we incorporate that concept? Because I think it's something that's not talked about at all. And how can we encourage our young people to, understand that is sexual assault?
So we work really closely with one of our local medical providers. We do a lot of programming with them, sort of as a partnership, and in that we've done sex ed bingo, and they've provided some really great comics around what safe sex practices look like and understanding assault. So that might be a way for you to broach those subjects, because like you said, you don't go into schools, and that can be a really difficult age group to have access to if we're not going into schools. So in your area, I would recommend looking at some local medical providers. So yes, Mitch pointed out, for us, it's Finger Lakes Community Health. That's a great partnership that we have together. So I would recommend reaching out to providers that in your area that you know do have these discussions, and how you might be able to partner together to maybe host events or host discussions or trainings, just to get those discussions going, because that is something that's really crucial. And a lot of people are very uncomfortable having discussions about sexual education with youth. It's uncomfortable enough between two adults, let alone when we're bringing youth in here, because then we want to give them the education, but we don't want to be inappropriate. So how much is too much, right? It's a really awkward dance. So I always recommend defer to the professionals, but ask how you can collaborate, because they'll know what to do appropriately, but that will show that community resources are working together to serve their community as a blanket and not just as silos.
Great.
In the chat too, a really important point got brought up by Linda, that some local community colleges offer human sexuality as a course, and instructors may be willing to be collaborators as well to talk with youth. There are also tons of awesome age-appropriate materials to talk about consent for all ages, in terms that are relevant and able to be understood by all age ranges. Something I know that we talk about a lot is teaching children the words for their bodies, so that if something does happen at any point in time, it's not caught up in a euphemism when they're trying to disclose that maybe something is going on. And there are people who do have differing opinions on that, I know, but that is to say that there are a lot of resources out there to teach consent starting very early on. And really, like, something I've honed in on so many times is that consent has to be enthusiastic. It has to be repeated. It cannot be coerced or guilted out of somebody. And teaching teens, especially that, you know, if it's not repeated and ongoing, then it's not consent anymore. They're much more, in my experience, able to hear and understand that than I think a lot of adults give them credit for, specifically talking about teenagers. But there are certainly ways to have that conversation about consent and good touch, bad touch with all ages.
Absolutely. I couldn't agree more with you. I have a teenager myself, so we have these conversations often in my house. And just to share a little personal insight, the way I worded it to my 16-year-old daughter was, if it's not a heck yes, it's a no. So just, even if she's just how she perceives it in her mind before she has to express anything verbally, if to her it's not a heck yes and there's some hesitation, then maybe it's a no and you need to take a step back. So yeah, and I do agree. I think teenagers are a lot smarter and than we give them credit for. So I think it's time to let them be empowered, but teach them how to be empowered in a positive manner. So so many thank yous in the chat, and I'm gonna give it another minute or so in case there's another question, but I want to extend my deepest gratitude to both of you. You were one of the first people who reached out and offered to work with us this year, and we were very excited to have you. I look forward to future collaborations. You mentioned two of our other partners. The New York State Education Department will be presenting later this week about Aaron's Law, and we work very closely at OCFS with Point Source Youth. So I'm glad to see all this collaboration between agencies and organizations. So on behalf of OCFS, thank you to yourself and Amy and Emily, who's hidden in the shadows, monitoring the chat. I appreciate you all so very much. If you have questions that you didn't get to ask today to Mitch and Amy, we have their contact information in the chat, and you can always reach out to myself, and I will forward your questions on. I look forward to future partnerships with you both, and I wish you all the best. And on behalf of OCFS, I'm going to say goodbye for this session, and I will talk to you all later. Thanks so much, guys.
Thank you.